We know there are many choices in internet radio, and the staff and host of LA Talk Live would like to thank you for choosing the internet's hottest destination for the most eclectic sound and invigorating talk. This is LA Talk Live. We are more than just talk.
Hello and welcome to LA Talk Live. We are Del and Debi's Mind, Body, Soul, and everything in between. I am one of your co-hosts, Del A.D. Jones, and I'm a certified spiritual psychology coach, specializing in the areas of personal growth, relationships, and recovery from narcissistic abuse and codependency issues. And before I introduce my wonderful co-host, Debi, I'm going to mention that we are a call-in show, and our number here is 323-473-3100, or you can post any questions you might have about our wonderful show today on our Facebook page, which is Del and Debi's Mind, Body, Soul. And now I'm going to hand it over to Debi.
Hello, everybody. I'm Debbie Carlin Boyle, the other half of Del Debi's Mind, Body, and Soul. And I'm a certified personal trainer, fitness instructor, and integrative nutrition coach. Today, we got the show for you today. We're excited because we're going to talk about everything around the field of plastic surgery, ranging from the latest procedures to the emotional and the aesthetic aspects surrounding the results. So to give us all this information today, we have an expert in the world of plastic surgery who is a plastic surgeon at Marina Plastic Surgery in Marina Del Rey, California. Will you please help us in welcoming our distinguished guest today, Dr. Ziad Hammoudeh.
Thank you.
Thank you, Dr. Hammoudeh. Thank you. Oh,
Yeah.
we're so excited.
I know. We're gonna let you talk a bit, but Debi and I have so many questions.
Oh my God. It's like papers filled here.
Yes,
Okay.
exactly.
So I love this subject because I think it's on everybody's mind at some time or another throughout a lifetime. And some people, it's almost, always on their mind. But what we want to do is get to know you and why and how you got into this field of plastic surgery. And then we'll get into what the latest and greatest stuff is that's
and
out
what
there.
You specialize in. So
Sure.
Let's start in the beginning. So I know, let's talk about where you grew up. A little bit about your background. We'd love to know you a bit more.
Yeah, I grew up mainly in South Jersey and then moved to Philadelphia.
East Coast guy.
East Coast. And so I stayed in Philly and I went to undergrad at Drexel University and then went on, did 4 years of med school at Temple University in Philadelphia. So I did all my schooling in Philadelphia. And then I did 9 years of training after medical school and I did 5 years of general surgery at Wayne State University in Detroit, a lot of trauma, and then moved to Rochester, Minnesota for Mayo Clinic plastic surgery. That was 3 years, and then I came here to Southern California, USC's aesthetic program, specializing in aesthetic plastic surgery, which is in Marina Del Rey and in Beverly Hills, and then I stayed on at Marina Plastic Surgery in Marina Del Rey.
And you only look 32.
I
How
know.
did you get all that
That's
crammed
a
in?
lot of
That's a lot
So-
of
Thank
living
you.
and a lot of learning for.
Yes. And going back, so at an early age, you knew you were going to go to medical school, but did you know that you'd be in the world of plastic surgery from an early age?
Well, one of my first experiences with medicine was actually plastic surgery, and my dad had really bad breathing problems, and he went to see a plastic surgeon, famous plastic surgeon in Philadelphia. And as a kid, I got to see how amazing plastic surgery can be in terms of it totally fixed his breathing and changed the appearance of his nose, and it was just amazing to me that you could do all of that with plastic surgery. So it was kind of in the back of my mind at the beginning, and as I got older, I got into high school, and I just thought surgery in general would be just awesome to do, and you can change somebody like that instantly, and it's an amazing, gratifying thing to be able to do. So I decided I wanted to go to medical school, but before that, when I went to college, I started volunteering at the university hospital, and I got the chance to shadow actually the same plastic surgeon who operated on my dad. And
wow.
Very cool.
so that was really a great opportunity, and I learned about his passion for cleft lip and palate repair, and so I
much
got
need.
interested in that, and then I went on to med school, and when I was in med school, I approached that same plastic surgeon. I said, I want to get involved in research. I want to do plastic surgery research. This is what I want to do. And so I started doing research on children with cleft lips and palates. And so craniofacial surgery was kind of my draw to the field, but I liked it all. I really was just, the whole field was just amazing to me. It's so broad and has so many aspects.
I know, and I have an issue with the word plastic surgery, because immediately the word plastic, for me, has a sort of an odd connotation to it, like it's not real.
Right.
But there is that whole side of plastic surgery, like you say, the reconstructive cleft palate, or some terrible, people have burn victims, or there's so many things. It's such a noble profession, is what I'm saying.
Benefits,
Exactly. It's not just a superficial, I just want to sort of look a little younger.
Yeah.
It's got so many other branches to it, which we're going to get into a lot deeper as we go into this.
Plastic surgery and cosmetic surgery, they're the same, right? I mean, it's in terminology, just when we say plastic, it's the umbrella for everything, both medical and aesthetic. And when we say cosmetic, is it only aesthetic?
That's a great question.
Yeah.
So
Curious.
Good one,
great
Debbie.
great question, because it's a
researching
definite
the show.
Yeah, it's a definite area of confusion for some
Yes,
people.
it is.
So the word the plastic surgery, the origin of the term actually came from the Greek word plastikos, which means to shape or mold. So although we use it in English to think of plastics as a synthetic material, it actually comes from that Greek word, which means shaping or molding, which is what we do to the body, right?
that.
So
Yeah.
as a plastic surgeon, we change both form and function, so meaning both appearance and how the body works. And so there's a very broad, plastic surgery means aesthetic or cosmetic surgery, but also reconstructive. So everything under that umbrella.
The umbrella plastic.
And people think of cosmetic or aesthetic because that's kind of what they see in the media and things like that. But it's really very broad of a field and includes everything from, cancer reconstruction, burn reconstruction, facial fractures, those congenital anomalies like I talked about, cleft lip and palate, and so much more, peripheral nerves, so many things that are ailing people that can be fixed all over the body with plastic surgery.
Yeah.
Which is so amazing and
Wow.
which I love. So,
Yeah.
it isn't. I mean, I'm sure there's a huge market in the cosmetic end of that,
Yeah.
being that as people age, especially.
Yeah.
But
Would you even say, have you worked mostly on the East Coast versus the West Coast, or is there a difference, do you find? Is there more people are prone to plastic surgery in the California, around LA type places, would you say?
Well, of all the places that I've lived, I mean,
Yeah.
aesthetics, plastic surgery is by far the most that I've seen here in LA. In the Midwest, it was much more about the reconstructive aspects, and that's where I did most of my training in the Midwest. So I got to see all kinds of trauma and reconstruction from cancer that was more of a focus there. But
can
here,
you describe some of what that looked like? I mean, because I can imagine, I know you think of melanoma, but there is things like sort of bone cancer and things like
Exactly.
that. So can you give us an example of some of the reconstructive?
Everything from breast cancer to sarcoma reconstruction, which is kind of on the limbs and on the trunk of the body, where you have just big, after the cancer's removed, you have a big opening there that you have to then fix that or fill it to close the patient so that they, get coverage of the wound. And so, sometimes you take a local flap or a regional flap, meaning moving tissue with its blood supply to rearrange it to close that. Or sometimes that means doing even a free flap where you disconnect tissue with its known blood supply from another area of the body and you transfer it there. And under a microscope, you connect those blood vessels up so that tissue can get life, from the blood flow.
Yeah.
And so it's really, really a very broad and rewarding field.
Yeah,
wow,
absolutely.
Very good. Very cool. So you knew early on. So you knew you wanted to be a doctor. Medical school was, without a doubt, something you wanted to do at an early age. But as soon as you saw what it changed in your father in two different ways, that was it. This is where I'm going to
For
focus.
sure.
Yeah.
I had my mind set on it. I never changed it throughout med school.
Were you the first doctor in your family, or were
I am, yeah.
Oh, very cool.
So you have a happy mother. No, I'm joking.
And where's your family? Are they still back east?
In Philadelphia.
They're still in Philly, so you go back and forth.
Yeah.
That's great. Well, it's impressive credentials, to
Thank
say the
Thank you
least,
very
and
much.
your residencies, and just, amazing.
So do you still work a lot with children with cleft palate? And so you do that, because I know that you talked about that you went on some of these trips abroad where where children, like Operation Smile and things like that. Is that what you were involved in?
I did do an Operation Smile, Jordan, in the country Jordan, in the Middle East. That was many years ago where I kind of got involved. That was a little bit before I was able to participate at a high level. But a little over a year ago, I went with Smile Network International through Mayo Clinic, and I went to India and did a whole bunch of cleft lip and palates, and it was an amazing trip, and I plan to hopefully go back soon to another trip.
And how does that work? Do they doctors, local doctors know you're coming, they set up like a triage almost so you go from one patient to the next, operate in the same day?
Yeah.
And then the follow-up, they follow up with the local doctors? Is that how it works, or?
A little bit. It's really set up well. The first day so they advertise, and then the first day of the mission, the patients come from all over, and they travel because they're people who they don't have access to good medical care, and it's for free for them. So they travel, and sometimes very many miles to come just to be seen and evaluated. So the first day is the screening day, and you evaluate them and see who's a good candidate for surgery and who's not, who we can help and who we maybe can't, or maybe kind of can do in another trip or something like that, because not everybody also age and prioritize, right?
Yeah.
And then we start operating, and then we see them at the next day before we start the next day's operation. So they get follow-up from us, and then if they're at the beginning of the week, obviously we can see them for the whole week that we're there.
So
we're still there for follow-up, but obviously down the road we're not there to see them. But if a lot of times we come back to the same locations, so the next year they can follow up. So I saw some people that had been operated on the previous years and then needed a revision operation or a different operation of some sort. And
gosh, I mean, that's not much of a lead-up time. It's like you arrive and then next day you're doing surgery.
That's right.
What when you say if they're a good candidate or not, what would you say is a good candidate? Is there a certain age or?
Yeah, they have to be. Well, they're also these are babies, and sometimes they're only a few months old, so they have to meet also because they have sometimes a lot of other health problems. So they have to be a certain weight. They have to have a certain hemoglobin, and basically just overall medical condition has to be satisfactory that they can go under anesthesia.
Yeah, and unbelievable.
What a great thing you're doing.
Yeah, and so you combine that, so it's wonderful. So you have one foot in the Hollywood plastic aesthetic surgery world, and this other one where you're going to India and helping these children that are born with cleft palate. I'm curious. It seems like these operations are done in, like you say, Jordan, the Far East, Middle East. Is it as common here? Is there some genetic predisposition that children are born with cleft palates in certain countries more than others?
A lot of it has to do with prenatal care.
Okay.
And so it's very important to when you're planning your pregnancy to go see your OBGYN and primary doctor and everything like that to get on the correct vitamins. Folate in particular is one of the things that's very important to preventing congenital anomalies. And so some of these patients may not have, in the more populations that are not having great access to medical care. For instance, when I was in training at Mayo Clinic, I went to Arizona and did a lot of children's training in Arizona, and they have a large Native American population in Arizona, and sometimes they don't have the greatest access to medical care, and they would come down to the Children's Hospital of Phoenix and get treated there. And so it definitely is important that all the prenatal care that can help prevent these things. But there is a genetic component in addition to environmental component that goes along with cleft.
Yeah, that's what I thought.
Yeah.
Is there any, I'm just curious now because we are on the subject of babies, and are there any procedures that can be done in utero?
That's one of the biggest areas of study in plastic surgery is that apparently the fetus doesn't scar, and so people are trying to work on trying to repair a lot of problems inside the uterus so that they can prevent scarring. And it's still an area that's being under development, but it's a very exciting area that people are very intrigued by in plastic surgery.
Yeah.
Wow, that's a good question. I never would have thought of that.
Yeah, well,
that you could do that.
Yeah, well, I just know that there's other procedures that they're doing, and I just wondered if that was
fix a cleft palate before they were even born. Wow, interesting.
Well,
we're just like so.
Really.
Moving on now,
Yes.
so you have a practice that's over at Marina Plastic Surgery, Marina Del Rey, right here, not far from our studio. So let's talk a little bit about popularity of procedures. And I don't know whether we want to divide it up between what's surgical and non-surgical, or we just, maybe we do that. Maybe we talk about the most popular surgical. I know you gave us some statistics, which I found very intriguing, and especially the way the rise in cosmetic surgical procedures have come up in the last 20 years.
Yeah.
Amazing to see, and certain things being more popular than others. And so we can talk about why that is and what that is. If that's okay.
Yeah, let's just take facelifts.
Yeah.
Let's start with facelifts. Because because they have evolved so much. We all think about, and I'm not going to name names, but some people that look windswept, that they had procedures, say, 20, 30 years ago. And I know these procedures have changed so much now. They're a lot more gentle, more natural looking, not so pulled. And I know a lot of people are also delaying having surgery because we've got all these alternatives there, which we're going to get to in a minute. But so would you say facelifts, have they become more popular, or are they getting delayed, would you say?
I would say most likely that people are kind of buying time with the non-surgical things more. The rise in non-surgicals has been tremendous. In fact, the statistics that you were mentioning, Debbie, are from the American Society for Aesthetic Plastic Surgery, and they release statistics every year on the number of surgical and non-surgical aesthetic procedures that are performed in the country. And you can look back to 20 years ago and see that in 1997 they had less than 1 million surgical procedures and less than 1 million non-surgical procedures being performed. And both have gone up since then, and the number of surgical procedures per year now is just under 2 million. So that's that's doubled. But the number of non-surgicals has really skyrocketed, and it's over 11 million people. So that's gone up about 15 times what it was in 20 years ago. And so it's people want those non-surgical things to less downtime, quicker recovery, and kind of just buying more time before it's time for a facelift.
But that's because there's so much more available to us in non-surgical. It's just become like a menu of things to avoid going through it. And I see even in looking, at Marina Plastic Surgery, the list of things that you offer could keep people from having to go under the knife for a very long time.
So I have a quick question, because I've not gone under the knife yet. I'm not saying I never will, but
no comment here.
So far, there have been no nips and tucks. But I've heard people talk about, and I've seen people actually that have had it, that a procedure where that you can sort of go under this, you can do things, you can lift without cutting. Is that really?
That's right.
Is that possible?
Yeah, there's a lot of more non-invasive things like this, like probably a thread lift is what you're talking about.
Yeah, that's what it was called.
There's always a spectrum.
5-stitch. It was in Europe, and
she
just said something about a stitch here and a stitch here and a stitch. So they weren't cutting, but they were sort of, I think,
but does it last?
Stitching.
Does that last, or do you have to redo after a certain period of time?
Yeah, it's not as effective as surgery, but that's kind of, there's always different patients want different procedures and different fits for each patient, right? So some people want that shorter downtime and quicker recovery and just a minor little touch up, and then there's other people who want just the full deal and are willing to undergo more a longer recovery and to get a more drastic result and more greater longevity.
Well, and also I think people, a lot of people want to just look a little refreshed, not so
Right.
tired. And especially, I think, for actresses, I'm thinking of soap operas and things like that, where you're on the screen so much. I mean, number one, you can't take a couple of months off or a month off or whatever, and to come back looking so drastically different that, a little sort of subtle pull here and there, I'd have thought would be
I have a
would be the way.
question regarding that.
Yeah.
So, is it better to go and have something like a facelift, eyelid lift, and earlier in life than later? So, is it the longer you wait, do you look more distorted afterwards? Is my question, because there seems to be a trend in when you see older actresses, let's say, or even friends, that if they wait too long, there's obviously more to do, and that it's so much more obvious. So my question to you is that a thing?
That's a great question, and it's hard to comment on some of those examples that you're talking about. We all know who they are, and I think that technology is improving now, and that's part of it. Techniques are improving. I think there's ways that, and there's been several actresses in Hollywood have gone on record and talking about things like ultherapy, which is an ultrasound
I have
tightening.
that question written down.
Yeah.
Tell us what that is.
So it's ultrasound tightening. It heats up the SMAS, which is the connective tissue layer underneath of the skin, which is the support layer of the face. And so it builds collagen. That heating effect builds collagen, so it lifts and tightens.
Yeah.
It's not as effective as a facelift, but it's good for some people, and some people are even doing it as kind of like a maintenance treatment to delay that facelift because they don't really need anything yet.
Okay,
But
I have a confession to make. I've had that.
Oh, you've had that. Oh, yeah,
I've
we've
had
talked
that.
about it.
Yes,
yeah,
I've
we've
had
talked
it.
about it.
I've just had it here.
Is it because you have some photographs on your website that show the results of that, the sort of before and afters. But are the afters an accumulation of several sessions, or is it after the first time that's the after?
Yeah, a lot of times it takes multiple sessions,
Okay.
and some people are, like I said, actresses are open about it, just getting it every year just to kind of maintain, like just kind of keep doing it, keep tightening and delaying that effect of
Yeah, I mean,
of
I
Kind
aging.
of a high-end facial, if you ask
Well,
me,
exactly.
in a way.
Yeah, I didn't think of it as a replacement of plastic surgery. I thought it was more just, I don't know, just a skin
A
thing,
tightening,
a
skin tightening
thing. But, I didn't have, drastic results, but I certainly, and it's painful. It's so painful, I have to say. Well, only because I can't take painkillers, but people do take painkillers to go through it, don't they?
We make stuff, give the patients things to make them relax during procedures, depending on what procedure it is and what is required per that procedure.
Yeah, well, it was just a little bit on the neck, but I just thought it was a little painful myself.
True confessions.
True confessions, exactly. There's going to be more.
I started. 20 years ago, I started doing pulse light treatments on my, I have a lot of skin damage from being a Southern California girl and laying in the sun, and now all those freckles, 40 years later, have manifested in many ways. Even 20 years ago, I couldn't stand it. And, as a personal trainer who kind of prided myself on being able to wear spaghetti strap or strapless things, that was really bothering me. And so I went, and that was a series of procedures that I had to do over like a 5-month period, once every 3 weeks.
Mm-hmm.
And it got rid of my freckles, but it isn't permanent. And is this a permanent thing, the ultratherapy?
I think everything is a little bit like it. The way I look at it is it turns back the clock a little bit, and depending on what you do, how much it turns it back.
Yeah.
But you still continue to age, and those effects still continue, but it just kind of turns things
Slows
back.
it down a bit. Exactly. That's what I thought it was.
And
for
with
myself.
a plastic surgery, and then we'll get off of facelifts and we'll go to popularities and stuff. And I know we have a question on Facebook, so I want to make sure we get that answered. As you're welcome to do, check out our Facebook page or call us and ask a question. So getting back to plastic surgery, so you're still going to age after you have, let's say, a facelift. I know people have had facelifts in their early 40s. So they're still going to age, correct? Or no, they avoid that because they've pulled the skin to a point where it's never going to go back.
Yeah, and it will age,
Yeah.
and you will age. It just like turns back the clock, and then the clock still keeps running though, but it's like at a new set point, sort of. If you think
so
about
you're
it
resetting.
like that. And To go back to
We have a caller.
Oh, okay.
Sorry,
Okay, yeah,
Great,
but
great.
let's hold your thought because
Yeah,
we
we'll
don't
get
want to
right
lose our
back.
caller.
Hello, caller. What's your name and where are you calling from?
My name's Kathy St. George, and I'm calling from North Carolina, but I live in Los Angeles.
Okay,
Hi, Kathy.
wonderful.
Welcome
Hi,
to our
Kathy.
show. Welcome.
Thanks for calling in.
So, do you have a comment you'd
I
like to
feel a
make?
little guilty calling in now because it's none of my surgeries are pertaining to the ones you're talking about now. But
that's
I just,
okay.
We're going to get to all of them.
I'm a big fan of Dr. Z, and he saved my life. So,
Tell
That's
us about
great.
it.
Yeah.
Tell us what did he do for you, Kathy?
now I'm not really into a lot of plastic surgery either. I've been decided to age gracefully, you might say, but I did at a young age. I had my breast done because I had a miscarriage and I'd been busty from it, and I just had a little teeny bit of implant put in, like from a B to a C, and they were lovely, and I kept them for 35 years.
Wow.
Wow.
Yeah.
And that was not a good idea.
Oh.
Even though
Did they
were,
leak?
I mean, I was a model, and I was a Playboy centerfold and did covers at an older age, actually, at 28, 29, 30. And,
Wow.
but they were very nice, and I just never thought of having them done again. And then at one point I started having soreness and caps, and they were getting harder. And I mean, I was thinking of a career in glass cutting at that point because they really were getting like, I didn't want to take my clothes off. I didn't, and I figured I was just going to be stuck with these for the rest of my life. And I went with a girlfriend to the Marina Surgery Center, and she was getting Botox, and I hadn't even had Botox in 5 years or anything. And I met Dr. Z, and I just kind of off the cuff brought it up that I had this situation, and I went in for a consultation, and it was also because, I hate to say it, but I had beautiful breasts originally, and they were famous breasts, you might say.
Well, if you were a Playboy bunny, I imagine that they were. We do have.
Yeah, I mean,
hold on
they were
one
well-known
second,
breasts, let's
Kathy.
just put
Hang
it
on.
that
We
way.
want to hear the rest of your story. I just know we have other callers holding. Continue to
Okay,
hold. We're
great,
going to
okay.
get to your
So
calls.
anyway, I just
no, go
wanted to
ahead.
say
We want to.
that
We want to hear.
He took them. Removed my breasts, and it was a long surgery. It was much worse than I thought. But anyway, I never thought I could be happier because I'll tell you, they're pretty. And he did a wonderful job. I don't take painkillers either, so that was the hard part.
Yeah.
But
Yeah. That does give you.
But I'm just really happy with his work. He's a wonderful surgein, and he's an artist.
Oh,
Thank
that's
you so
Oh,
much,
that's
Kathy.
great.
Thank you.
Thank you
Thank
so
you
much
so much
for that
for sharing
endorsement
your
for him,
story.
because I happen to agree with you. I think he's a wonderful person, taking time out of his busy day to come
Thank you.
help us
Yeah.
too here today.
Well, thank you so
Thank
much,
you. I'm
Kathy.
glad you
Well,
had
Thank
positive
you.
results. That's so
Thank
great.
you
Thank you.
So much, Dr. Z.
You're welcome, Kathy. Thank you for
Dr.
calling.
Z.
Thank you, ladies.
So, do we still
We,
have
we still have a caller?
Another caller?
Caller, are you there?
Hi,
Hi, who's this?
this is Angie.
Hi, Angie.
Hi, Dr. Z.
Hi, Angie.
Hello.
How are you today?
But I just tuned in. So,
Oh, good.
we're talking about Dr. Z and my
Yes.
experience.
Yes,
Yes.
yes,
Anything
we
you
want to
wanna share?
hear.
Oh my gosh, seriously, he is so amazing. He completely changed my life. I did a whole mommy makeover. I had lost like 60 pounds in a divorce, and went in to see him pretty much like down on myself, and he made me feel really, really comfortable. And oh man, a complete 360. He was there for me through the whole way. The staff, everybody was great. I look like a completely different person. Like, I can't even tell you. I could just like actually even cry, like sitting here talking about it. But like,
what did he
it
Thank
did
do?
you,
was
What
my
procedures
self-confidence
did?
and everything.
What were your procedures?
Huh?
What were the procedures that you did as a mommy
I did
makeover?
a lipo, tummy tuck, breast lift and a fat transfer to my butt.
Oh, wow.
Very cool.
Wow.
And how did all that feel? And did you have it all done at once or over different
All at
stages? All at once. Wow. Gosh, you must have
Drain does a drainless tummy tuck, so that made it that much easier for me to want to do it. Because
Yeah.
I've always kind of wanted to do it, but I was always afraid of the drains, you know.
How did you sleep at
it was
night?
fine. I was back to work after 2.5 weeks.
Wow.
I'm just thinking
That's excellent.
sleeping because you've had stuff done on the front of
front
your
and the
body
back.
and the back. It's like
on the side, right?
Right, yes, I slept on the side. And to be honest with you, like, it was, I'm not going to say it was painful. It was just uncomfortable for a little bit. That's all. I was controlled with pain meds very well. I was very comfortable. The recovery home was amazing. You go there for like a night after, and they're wonderful. And every day I just got better, and he was very attentive. I was always able to call him, text him, come in whenever I wanted, any concern that I had. But honestly, Dr. Z, how many patients did I take to you already?
Oh my goodness, you're like the number one referral source. I don't know. You must have sent me at least 20 people or so. I mean, it's unbelievable.
You're his walking billboard.
Yeah, and I'm gonna go see you I'm gonna see him next month for my rhinoplasty too.
Oh my goodness, that's such a great testimonial.
Great.
Thank you so much. Well, that's our music.
Thank you
welcome.
for calling.
My pleasure, Angie.
Thank you, Angie.
Look forward to talking to you soon.
We're about to take a break, but I want to talk about popular procedures, and I want to talk about downtime and different procedures, and I mean, we just have to get to everything.
Exactly, lots to talk about. So
Yes.
we'll be back in 2 minutes.
Yes,
We're
call
Del and
in
Debbie's
if you have
Mind
a
Body
question.
Soul, and we'll be right back in 2 minutes.
Thanks.
We know there are many choices in internet radio, and the staff and hosts of LA Talk Live would like to thank you for choosing the internet's hottest destination for the most eclectic sound and invigorating talk. This is LA Talk Live. We are more than just talk.
Hi, I'm Del Lady Jones, and I'm a certified relationship and divorce coach.
And I'm Debbie Carlin Boyle, a certified personal trainer, fitness instructor, and health coach.
Join us on Tuesdays, 2 p.m. Pacific, for Del and Debbie's Mind, Body, Soul, and everything in between, exclusively on LA Talk Live.
Become part of the conversation with expert guests discussing life-changing topics such as relationships, divorce, longevity, parenting challenges, dating, intimacy, and so much more.
We would love to hear your opinions and questions, either on our Facebook page or by calling us directly at 323-473-3100. We are Del and Debbie's Mind, Body, Soul, and everything in between. Tuesdays, 2 p.m. Pacific on latalklive.com.
You can also catch us on iTunes Radio, R&B, and now live on Facebook, or watch and listen directly at latalklive.com. And now on our YouTube channel, Del and Debi Mind, Body, Soul. Reality radio handcrafted for your listening and viewing pleasure. This is LA Talk Live, and we are more than just talk.
Hi, I'm Del.
And I'm Debbie.
And as a special thank you to our listeners, we'd like to offer a complimentary coaching session with either one of us or both of us if you so choose. Check us out on our individual website, deladyjones.com and fitbydesignla.com. We can work with anyone, anywhere, in person or remotely.
Contact us through our Facebook page or website at Del and Debi Mind, Body, Soul, and leave your info and we will get right back to you. We look forward to assisting you in living a happy, healthy, and fulfilling life.
Hi, welcome back. We are Del and Debbie's Mind, Body, Soul, and everything in between. And we have a wonderful, fascinating show today with the incredible Dr. Hammoudeh. And we're talking about plastic surgery and everything else too, not just the surgery plus all the latest techniques that can help people avoid going straight into surgery. So where were we?
Let's talk about, I was wondering if we could hit on the top 5 most popular procedures from top to bottom on that.
Sure.
And then I think we should get in a little bit into rhinoplasty. It's something that I did. And it changed my whole way of the way I felt about myself. And I want to get into that and plastic surgery and
Absolutely.
because mine wasn't only a cosmetic standpoint. So, the same thing that it did for your dad, if we could. So,
well, first of all, we're going to go through the top 5.
Yes.
Though. So those are...
According to the American Society
Yeah.
for Aesthetic Plastic Surgery, which releases their statistics every year, liposuction was number 1 in 2016. Breast augmentation was number 2. Tummy tuck was number 3. Eyelid surgery was number 4, and breast lift was number 5.
Now, is this across men and women?
This is for both.
For
And
both.
It
Both
varies a
genders.
little bit for
Okay.
when you look just at the men's procedures.
and the
so.
trend is year to year, all 5 of these are going up statistically, correct?
Yeah, the total number of surgeries, aesthetic surgeries performed in 2016 went up from 2015.
Okay.
Wow. Because, breast augmentation, people think of that as a female thing, that just women, but a lot of men have, is it called
Man boobs.
Sure, gynecomastia,
yes.
which is overproduction of male breast tissue, and they get
Exactly.
it's like a breast reduction, actually,
Yeah.
almost, where you're reducing that male breast tissue,
Yes.
removing it, and giving them a more flat contour
And that's
chest.
something that's becoming more and more common, isn't it?
Yes.
And there are all these things that people say that there's estrogen in our water, and that these
Our
things
milk
that-
supplies,
that are
and-
all
yeah.
adding to this. But it's a very serious problem that a lot of men, suffer from and are very self-conscious about, and it can also lead to breast cancer, can't it, in a man as well?
Well, the rates of breast cancer are very low in men, and you can find breast cancer when you do remove that tissue, but the rates are very low, as they are low in men. When you can get breast cancer in men, that the same way that there's genetic predispositions to breast cancer, there's certain genes, mutations that can increase your risk, but overall it's very low in men, unlike in women where it's much more common.
Yeah. Okay. And the liposuction, do you think people are using that for like spot reduction, or is that more because they just really want to lose 15 pounds?
That's a great question. That's one of the things that people come to me all the time and ask about. That liposuction is not a weight loss procedure. It's not good for helping people lose pounds off, and it's more for contouring and changing shape. So if you have a stubborn area of fat and just a little bit of bulge somewhere that's bothering you, that's just the way that you were built, it's great for that kind of person, where it kind of just changes that shape, like the love handles or a little bit of belly pooch or anything like that, thighs, something like that, where there's just the shape is not exactly what the person wants. You can change that with liposuction, but it's not a treatment to help somebody who's overweight. I usually recommend, if somebody's above a certain body mass index, that they lose some weight and then kind of undergo surgery, because they want to be down to their ideal weight before kind of contouring their body.
That makes sense.
Yeah.
And are there
absolutely.
different ways of doing liposuction? Like, is there there's more evasive and less evasive? I always see like these new, little vignette things come out, segments on shows.
Cool sculpting or something.
Is that? But
That's non-surgical.
That's
So there's
non-surgical,
surgical and
yeah.
there's
Yeah.
non-surgical.
Are there different surgical ways, I guess is what I'm asking,
There's
before
different
we do the
techniques. There's standard liposuction. There's ultrasound assisted, which you get the vibrational and some heat energy. And then there's power assisted, which is also vibrational but without the ultrasound. And then there's laser liposuction. There's all different ways, but...
And do you take it individually, case by case, on what you recommend, or are you an expert at one more than another that you'd rather see people do because they have better results, less maybe healing time? How do you determine?
I've tried all of them, and I prefer a certain one over other ones, just because the main thing is that you remove fat and the skin will tighten up around that. So also you want to make sure the person's skin quality is good and not loose, because if you take out the fat and then the skin potentially can become more
Sag.
loose, saggy. So you want to have, the ideal patient is somebody who has good skin quality, good tight skin and healthy skin that can tighten up as you remove that fat. So you assess the skin in addition to the fat that's underneath before the surgery. And the main thing is really just that reduction of fat, and the most efficient way to do that will help the skin then tighten around it.
And what is that most efficient way? Which one of those procedures?
I prefer using the power-assisted liposuction, which is a vibrational cannula. It just helps, in my opinion, in my hands, to remove that fat more efficiently.
Good to know.
To feel a little faint.
Okay. Okay. We won't go too detailed.
Exactly,
all right.
not too detailed for me.
Sorry. I didn't know that. Okay. Moving on.
Oh yes.
Okay. So the next one was we talked a little bit about breast and then tummy tucks. That's really popular. That's sort of the mommy makeover part, right?
Mm-hmm.
Is that
that's right?
Do you find that most of your patients that come in for tummy tucks are post childbirth?
Yes. That's the most common reason, is after the uterus expands and then kind of shrinks back down after the delivery, the rectus muscles, the six-pack muscles that run on each side, they spread apart to kind of accommodate the uterus and as it expands. So then after the uterus contracts, they don't quite go back to the normal anatomic position where they were before.
Yeah.
So in that case, you want to tighten those muscles up by suturing them back together.
Wow.
And so that
so you do some underneath?
improves the core. Yeah, exactly. And then you also remove the loose skin, because as it stretches out, it doesn't totally retract back some people it does, some people it doesn't, or in some people it's better than others.
So I have a question. Yeah. What if you wait too long, like 30 years? Can you still do a tummy tuck and tighten those muscles?
Yeah, absolutely.
Okay.
Yeah.
All right.
Debbie and I have
I'm
a little
making
Christmas
notes.
list going here. Maybe I'll have one of those for Christmas. It's never too late. Okay. So
moving on. And so then I want to ask you about eyelid surgery. And does that, when we talk about eyelid, that's lifting the eyelid. Do you go from the forehead? Do you do the eyes individually? Do you go underneath? Do you do the whole? How does that work? Or is it just there's a
Great question. So it depends. Everybody has a little bit one of the things that people come looking, they say, I look tired, I want a rejuvenation around my eyes, and then they don't always know exactly what it is that's causing that. And sometimes it's the brow is down, the eyebrow, and then you need a brow lift rather than more so than the eyelids. But sometimes it's the loose skin that's in the eyelid, and so you remove the skin there, and sometimes they have bulging fat, so sometimes you need to remove some fat on the inside of the eyelid. And then the lower eyelid's the same thing as similar to the upper eyelid, but it depends on what exactly is going on that's causing that problem. And sometimes it's, the tear trough area is very prominent. We can put filler, or we can put fat in there, fat grafting, the person's own fat, and fill that out and kind of smooth that transition. So there's so many different techniques, but those patients, when they look more refreshed, and they're some of the most happy patients, and their eyelids, they just feel more awake and more protein.
The eyes are a funny thing. Yeah. I just feel like it's such the window to the soul, and I don't. It's so hard when I look at people that have had very obvious eye surgery. It just, there's something that just disappears.
That's the real trick. I mean, I'm going to be 60 in a few months, and that's a real bone of contention for me. It shows my age, or my eyes, my neck, which is usually the first thing that does with people. But I remember watching a movie, and I can't remember whether it was Judi Dench or not, and she looked in the mirror, and she was a grandmother in this movie, and she looks in the mirror, and the line is, I just don't recognize this woman anymore. And I know that feeling. I mean, you get to a certain age, you're so young, but you get to a certain age, it's usually somewhere in your 50s that you just go, who is that? And that's where, at this age, I can see wanting. I mean, I would never have considered any surgery before, and now I have a laundry list because I can't recognize me, and it's bothering me. And I can see how, especially here in LA, I can see how people get into that, and so I know you have some examples of things with you, and I want to have you share that, but I also want to get into the emotional aspects of helping people feel their best but look their best naturally, and so changing because if you're feeling down because your face isn't what it used to be, or, you've got those dark circles under your eyes, I can see how surgery is just going to make everything better. I'm a perfect example. It changed my life. And you talked about that with your dad, how it changed your life.
But then there's also, I mean, I'm just jumping in here, but you have to be so careful with that, the expectation. I mean, we are aging, and there's only so much that surgery can do. And it has to go hand in hand in a realistic expectation of the outcome, and also doing, I would imagine, a lot of internal work too, to come to, I mean, because aging, yes, sometimes I think it's amazing. We all sort of wither on the outside, so we go deep inside and really get to the heart of what's mostly important.
Yes.
I mean, when we're all younger, we're so about this sort of, the external, and I look at as aging as that just wonderful journey on that, inside and really what's important in life, and it's balancing
really well.
Well, and balancing both of those things. So, can you address that?
Yeah, I mean, everybody wants to look their best to help them feel their best, and everybody remembers what they used to look like, and nobody wants to look any worse than they did in the past. They always want to look the best that they can possibly look, and that's what it's about. It's about having realistic expectations of who you are, and maintaining your health and beauty and as a person, and just aging gracefully, And to go back to the points that we were talking about, that overdone look, you always want to go for a natural look, something that just a more refreshed, better version of yourself. You don't want to be looking unnatural. You don't want to look done or anything like that in some of those cases that you were talking about. And that's also partly technique driven too, like when we were talking about facelifts, you don't want to pull the skin back tight so the skin looks stretched. You want to tighten that SMAS, that connective tissue layer that's underneath that supports the face, and then you just just take the extra skin out and redrape it so it's not pulled tight. It's just laying naturally right over the face.
Wow.
And it's a similar concept with eyelids and all the procedures that we're talking about. You always want to achieve a natural looking result.
Yeah, that's great that you have that attitude, because I wouldn't assume. I'm going to assume that doctors should have that attitude, but then there's also the cost factor, and there's a lot of money in cosmetic versions of plastic surgery, I'm sure, and even non-cosmetic. I mean, there's insurance to be it just, so there's that weariness, and people sometimes they save up for years to be able to do a procedure, so the expectations are are high, and the jitters, it's really,
I do have to I know we're off subject a little bit, but I saw this, I don't know where I saw it the other day, but there are certain people, I know that there are two people specifically, a male and a female, that wanted to look like Barbie and Ken, and they've spent the dolls, and they've spent
people that go after stuff like that.
Exactly, thousands and thousands, I mean, hundreds of thousands of dollars to have the procedures and to look like that. I mean, where does the profession
the surgeon draw the line?
Yeah, exactly.
Absolutely, great question. It's always a balance that you have to make sure that you get a natural looking result and don't do anything that's going to be excessive or beyond what's normal. And I think that all starts with the communication that you have with the patient, building rapport in the consultation, and just understanding exactly what they're going for and communicating to them what it is that I think that I can achieve for them within reason. You want to give them what they want, but they need to get what is also reasonable and will be within normal limits, and that's that's the balance of there's the artistic aspect to it, but it's a judgment call, and it starts though with communication and understanding from both sides. You understand them as a patient, and as a surgeon they understand you.
Yeah, because I can completely understand somebody bringing in a photograph of a celebrity and saying I'd love Jennifer Lopez's nose or something like that, but when somebody comes in and says I want to look like this 12-inch plastic figure. Yeah, I think that's a red flag.
Exactly.
Wait a minute.
Do that.
Yeah.
So I think we should talk about what you have, and then we'll go back to the non-invasive,
Sure.
non-surgical way people are cosmetically changing and all the new and groovy stuff that's
Sure.
come out.
Yeah.
Sure. So since we were talking about the latest and the greatest and the newest things out there
Yes.
and what's changed in the last 10 years, I decided to bring the
Up to your microphone.
Yeah.
the
Right.
newest,
We
the
wanna hear
newest,
it.
the
Yeah.
newest generation of breast implants, which is the 5th generation, and that's the highly cohesive silicone gel, which is known as gummy bear breast implants. So
Okay.
it's the reason it got that name is that it's a gel that's that if you were to cut this breast implant in half, you would then have 2 separate halves. Whereas in older models, the gel was less cohesive and it would spill out. So that's a major
So now no
advancement.
leakage is
Yeah.
what you're saying.
So,
no
yeah, so
leakage
it's-
in this silicone.
Yeah,
new
it's like if you
silicone.
cut this in half, you'd literally have 2 separate halves.
Wow.
And
So it doesn't go hard and what's that word you use when encapsulate?
you can still get
Encapsulates.
capsular
Oh,
contractions
you
because
can?
it's not solid silicone,
Oh,
but
okay.
it's more cohesive, so it resists rippling, and so that was always a problem that was existed in the past, especially with saline implants, which
Mm-hmm.
were the only thing that were available for new augmentations in the 90s. Because in 1992 there was a concern that silicone
leaking.
implants maybe were leading
Yeah.
to some health problems that
Autoimmune
women
Yeah,
diseases.
exactly.
Yes,
exactly.
Yeah.
because it was
And-
leaking into the bloodstream.
Exactly.
Mm-hmm.
So in 1992, the FDA put a moratorium on silicone breast implants, and so everybody went to saline, and they were going under the muscle to conceal that rippling. But saline is just salt water, so it's just like kind of like a bag of water that can move around, and you can see those kind of
And
ripples.
I was just going to say, and could they burst and then you just have
Well, they
They-
do deflate.
Yeah,
Yeah.
they could burst, and then
Yeah.
it would all just it would.
I mean,
deflate
saline is
It
great.
would
It'll
absorb.
just
The
absorb.
idea
Right.
is the water
Right.
absorbs
Yeah.
into your bloodstream,
But you
so
would
it's
be left
safer.
with a deflated.
Right.
So let me
Boob.
ask you, so do you recommend this, and are these done in front of or behind the muscle?
So when patients come to me now after they lifted this moratorium in 2006, silicone implants took off again, and so I personally, they feel much more natural, and even the saline implants, the shell of the implant around it was made of silicone. So after they found that in studies that these did not substantiate those fears, that this is now the preferred implant that we do. And this is a round version, a round textured version. And I have an anatomic or teardrop shaped version, which is just gives a more natural shape where the fullness is projected more at the base
Yeah.
and kind of slopes gradually.
They
And-
look great. Yeah,
and some
really good.
some people it's based on personal preference.
preference.
So.
In front of or behind the muscle?
So you can do either. I actually prefer to do a subfascial technique where I go above the muscle but below the muscle lining with this highly cohesive gel because it doesn't ripple as much. So that's my technique, and depending on the person's body shape, if they don't have a lot of breast tissue, I'll use a teardrop shaped anatomic implant to kind of create that shape for them, or in a breast reconstruction, let's say where they have no breast tissue anymore after a mastectomy, I choose to do it with this teardrop shaped.
Okay.
Now, in some people, they want a more round look, or they have a lot of breast tissue coverage, so this round fullness at the top doesn't show as much. And so in those people, I choose a round implant, or they tell me that they want a round implant, and I think it's okay for them, then I'll choose a round. But
Now, I just
good to
as
hear.
before we move on to
What's
the
the
other,
newest?
which we definitely
Yeah.
want to, I just want to add another quick thing while we're talking about boobs. Would you? I know that you can also place like you can take fat from other parts of the body and put that in your breasts as well. Would you do that along with an implant like that?
sometimes,
Yeah.
sometimes it depends on if they need a little bit more coverage on top of the implant. They can use their own fat. And some people come to me just asking for, I want a totally natural breast augmentation without implants, where I don't have to change them out or ever worry about them again, and I want my own tissue. Then I'll do liposuction, remove their fat, process it, and then re-inject it back into their breasts or other areas of their body that they want.
Now, is there
augmented.
any? I've heard people say that it can reject. Can it reject your own body fat, or is it always 100% successful?
So about 50% in the studies, that shows that about 50% goes away, or maybe a little less than that in some studies. So it doesn't completely, because that fat has to grow its own blood supply. It has to revascularize. So to live, it has to have blood supply. So you want to put just the right amount in where it's touching other living tissue, so it grows its own blood supply. It gets nutrition so it can stay alive. So the amount that you put on the operating table is not going to necessarily be the exact amount of what it looks like down the road, but a large portion of it stays, and it's permanent.
I can't believe I'm getting through these conversations without fainting.
I'm right here for you.
I'm a fainter.
What else did you bring today?
Sure.
Thank you.
So
and then we'll talk about.
We have so many non-surgical procedures, but this is the latest one that we have in our office now, and this is called the Obalon intragastric balloon, and it's a balloon that is a gas-filled balloon. So there was other balloons on the market that came out first that were saline-filled balloons, and you can imagine having kind of more than 2 of these sitting in your stomach at one time. They would feel really heavy and full, and it's for weight loss.
Weight loss. Okay.
Yeah. So this is for those patients that are having a hard time losing weight, and they're not a surgical candidate at this time, or they just come in, maybe they never want surgery, but they want to lose weight. And so I'm trained as a general surgeon as well, where we did all these weight loss surgeries as part of general surgery, like gastric bypasses, gastric sleeves, lap bands, but they're all surgery, and this is non-surgery. So this is a gas-filled balloon, and the way it works is that the first thing is that you swallow a capsule, and the capsule is just like a big pill, and it has this catheter that's connected onto it, and that catheter is then inflated with the gas, and this capsule.
Wait, is the patient asleep when they swallow it? Oh,
no, they're awake. They're awake. It turns into this. It turns into this balloon right here, and they do this 3 different times. And then this balloon,
3
it's
different
super
times,
light.
You mean over a course of a period, or
yeah,
all
over
at once?
weeks.
Okay.
All right.
Over weeks. And so they can adjust to each one. And then the balloon, it's because it's gas filled, it's light, it floats to the top of the stomach, unlike the saline ones, which were heavy and would kind of float to the bottom of the stomach, or sink to the bottom of the stomach. They then take up space in the fundus of the stomach, which is where the person feels full, the satiety center. So it stretches that out, and you have 3 of these, so you feel full, so you don't eat as much, and so you didn't need surgery to kind of change your stomach shape or anything. And
how safe is this?
It's FDA approved, and it's been, so it's
what happens to it eventually?
So that's exactly where I was getting. So it's combined with nutrition counseling for a whole year, and so you also have to change your diet, because if you imagine if you just ate milkshakes and milkshakes and soda all day long, you wouldn't lose any weight, right? Because it's just liquid, it would go around the balloons and everything. So change your diet, and then once you get down to that new lower weight, then you remove the balloons endoscopically, same as if anybody's had a colonoscopy, they know what that's like going to sleep. But it's the same scope that's from above through the mouth down the esophagus, and that they use to look at for ulcers and things like that. So
you're kind of asleep. Burst the balloon?
It's popped and then retrieved. And so after that, once you're to maintain weight, calories in have to equal calories out, right? So if your calories in are less than your calories out, the calories that you burn, you're going to lose weight. Then once you get down to the new weight, once you maintain that balance, calories in, calories out, then you should stay at that same.
Bigger picture than me, because no 2 calories
amount
are
of weight that people would need to lose to go and do a procedure like this? This is not for like 10 pounds, or is it? I don't know.
It can be, but I mean, we hope that people will lose more than that. I mean, we've had several people who have lost over 50
pounds. Kind of a jump start
doing that.
Really.
So it's a jump start that.
Just come see me. You won't need to do this, folks.
But I mean, if you're somebody that only has 10 pounds to lose, you wouldn't do that, or would you?
Well, they have to. So the FDA approval is for people who have a body mass index between 30 and 40.
Oh, so
you figure out. So you figure out where they are, and obesity is at 30. So that's the classification of obesity, BMI of 30. So they have to be within that kind of range. So they want to lose more than 10 pounds.
Usually they're about 40, 50 range.
Now we're losing out of time, but I have a very quick question for you.
I know. So we didn't get to the non-invasive stuff.
Yeah. What is your favorite procedure to do? What's the one where you really feel
Like you're
I
made
mean,
a difference.
I really love doing the whole spectrum of plastic surgery, and one of the things I really love doing that we haven't talked about much yet is doing rhinoplasty. And as we started the show, kind of talking about that, because it's both form and function. It helps breathing. It really helps, in that regard, quality of life. But then it also can change the appearance of somebody's face and make them look much more appealing in the way they want to look.
Example of that. Yeah.
And
we did have also a Facebook question about safety and procedures these days, and do you think there's a fear of safety because people are going to there's so many more non-surgical now? Do you feel like is it safe for people to go under the knife? Is basically the question on Facebook.
I think safety keeps improving every day. I mean, there's always people who are nervous about it, and for those people, maybe non-surgical options are best. But safety is number one priority. Okay. And we do a lot of studies in plastic surgery on safety and keep improving that. And we want to keep getting that better.
Wonderful.
Going
and
we're running out of time. So
wait, one more. We want you to be able to give out the information on how people can reach you.
Yeah.
I mean, you don't have to give out your phone number. I know you give your patients your phone number, but don't do that. But how they can reach you for a consultation or talk to you about any of these surgical or non-surgical procedures.
Sure. They can go to our website, marinaplasticsurgery.com, or find me on social media. It's at Dr. Hammoudeh, at DrHammoudeh, or they can just call the office at 310-827-2653.
Wonderful. Thank you so
much.
much.
Thank you. This was just great.
Yeah.
Just a great information.
Just not enough time to cover it all.
Thank
but
you.
Yeah, really wonderful. Thank you so much.
We're going to be back next week. We're going to talk a little bit more about beauty and health next week. So join us. We're Del Debi's Mind Body Soul. Bye, everybody.
Bye,
See you next week.
Have a wonderful week. Bye-bye.
Thank you for tuning into LA Talk Live and the Talk Live Broadcast Network, original reality radio, and crafted for your listening and viewing pleasure. This is LA Talk Live, and we are more than just talk. Stay tuned.
I can't stop this.
Radio and the staff and host of LA Talk Live would like to thank you for choosing the internet's hottest destination for the most eclectic sound and invigorating talk. This is LA Talk Live. We are more than just talk.